Good evening, guys. Tonight's discussion A, we're going to discuss a new digital healthcare system proposed national digital initiative for simplifying um, the nation's healthcare system. So here we go. This refers to a recent announced national initiative to build a unified digital infrastructure for health data designed to let individuals access, manage, and share their medical records and wellness information seamlessly across providers, insurers, and consumer apps. It's framed as a public private partnership involving government agencies, major technology firms, and healthcare organizations. And it has sparked both optimism and debate about privacy and control. The text points to a new healthcare data tracking system that aims to break down the uh, silos that currently exist in healthcare. Today, medical records are often fragmented, locked inside hospital systems, insurance databases, and scattered across apps and devices. This initiative proposes a single interoperable framework where diagnoses and lab results, prescriptions, imaging, and even fitness or nutrition data can flow securely between platforms. The vision is to empower patients with greater autonomy over their health information while while enabling providers to deliver more coordinated and efficient care. Who's involved? The effort is described as a collaboration between federal regulators and private sector leaders. Government role: setting standards, ensuring compliance, and providing oversight. Private sector: tech grants, electrical health record, EHR, vendors, insurers, and app developers pledging to adapt common protocols. Healthcare providers: hospitals, clinics, and pharmacies are expected to integrate their systems into the network. This coalition reflects a recognition that no single entity can solve interoperability alone. It requires cross industry cooperation. How the system would work. At its core, the system relies on standardized data formats. So records from different hospitals look and function the same. APIs, application programming interfaces that allow apps and platforms to securely request and share data. AI-driven integration tools that can compile information from multiple sources into one single patient dashboard. Consent-based access controls, where patients decide which apps or providers can view their information. Image and scenario, where your blood pressure readings from a smartwatch, your prescription history from a pharmacy, and your imaging results from a hospital are all visible in one place, ready to share, shared instantly with a new doctor. Key benefits. Supporters emphasize several advantages. Continuity of care, smoother transitions. When patients move between providers or regions, efficiency, reduced duplication of tests and procedures. Patient empowerment, individuals can carry their health history with them, much like a digital passport. Personalized medicine, apps and clinicians can combine clinical and lifestyle data to tailor recommendations. Research potential, anomalies data could accelerate medical studies and public health monitoring. The boldness of the plan raises serious privacy and ethical questions. Data security, risk of breaches increases when information is centralized. Commercial use, fears that tech companies might monetize sensitive health data. Consent complexity, ensuring patients truly understand what they agree to share. Equity, making sure marginalized communities benefit rather than being excluded to explicit or exploited. If, officials promise robust safeguards, including inscription, strict access rules, and oversight mechanisms, but critics argue that governance details remain vague, and without clear legislation, protections may be uneven. Next steps and what to watch. The rollout will hinge on publication of technical interoperability standards, identification of pilot programs in select regions, clarification of consent models, how patients grant and revoke access, possible legislative action to codify privacy protections and penalties of misuse. Observers are watching closely to see whether this becomes a transformative leap toward patient-centered healthcare or another. Ambiguous project slowed by privacy battles and industry resistance. This initiative sits at the intersection of healthcare reform and digital innovation and civil liberties. It promises convenience and empowerment, but its success will depend on whether trust can be built around who holds uses and protects the most intimate data people have, their health. Okay, guys, so that is A for this evening. I will try and do another show before bed. So give me a little bit for B, and I'll be back on with that for you. For now, Gator Wellness, take care, folks.